when we will have more time to talk, because I know we like to talk. All right, I'm going to stop talking because we are ready to kick off our afternoon. Looks like our panelists are getting set up with their mics, but thanks for the great conversations. And I'm going to mute here and turn the floor over to Karam.
Thank you, Sarah. And right on the dot. Yeah, I think we can get started. As folks are making their way into the room, just a reminder, especially for those that have joined us a little late, there are interpretation services available. So just go see the folks at the front desk at checkout, at checkout. It's my retail days, at registration, and they can hook you up. Good morning, everyone. My name is Karam Ahmad. I am the new Managing Director for Partnerships and Development at the Colorado Health Institute. Super excited about this role. In this new role, I'm really going to be focused on building bridges, building partnerships with all of you in this room and folks around Colorado and across the country in advancing health and well-being and thinking about how we can do that together. So if ever you have a question on anything, give me a ring and happy to chat. Today, so, why do we have journalists at a health conference? Well, both public health and media are navigating really this era of distrust, grappling with misinformation, with public skepticism all the time. The parallel between both health, public health, and media, both of these sectors is really critical to look at, because how the public understands and grapples with health issues is really shaped in part by, very largely by how the media presents these issues. So we're gathering today, of course, in the wake of the 2024 election, some shakeups in congressional representation, some interesting local ballot measures. These shifts are undoubtedly going to have an influence on our public discourse, the way we talk about health, the way we think about health. And, today, as Sarah mentioned earlier this morning, we have really our three pillars at CHI. And the one that we're really going to be focusing on in this session is how we really focus on making sense of the complex issues. How do we communicate about them? How do we think about them with the community and with the folks that we serve? And all that to say, today I'm joined by some really amazing expert journalists, Stephanie Daniel, Senior Managing Editor from KUNC, Megan Verley from CPR, the Public Affairs Editor, and Luigi Del Puerto, Editor of both Colorado Politics and the Denver Gazette. Did I get that right?
You did.
Awesome. Perfect. So just as a reminder, we're going to have about 15 minutes at the end for a Q&A. Folks online, feel free to put questions in the chat, either using the questions feature or just in the chat, and we'll get to those at the end. We will have a mic runner, 15 minutes at the end, and we'll be answering those questions. So really excited to dive into this discussion. Where we're going to first open up on is, and this question is for each of you. So what first sort of drew you into media? Who got you into the field, and what sort of inspired you to become a journalist and a person who works in the media?
Am I going first?
Yeah.
Okay. So I was a young man who was very idealistic and a little bit stupid. And in hindsight, I should have taken another profession. I'm kidding. I actually love what I do. I was born in the Philippines, grew up there, and went to the University of the Philippines. And I always wanted to write. I loved writing, went through the usual rounds of becoming editor-in-chief of the school paper and what have you. And I thought, wow, that's just a really cool job, to be a journalist, to be at the forefront of what's happening in society, to have that front row seat to crazy. Sounded very, very exciting. And I don't know how much you know about the Philippines. How many of you know the Philippines exists? Oh, that's awesome. We're all squared away. And at the time that I joined journalism and journalism school, it was a very chaotic era in the Philippines. Just emerged out of martial law from a few decades ago. A batch of courageous journalists who went underground because they were being hunted, they were being jailed. That was the best outcome, or worse, killed at the time. And so I thought, wow, I should join this group of really good people. And I was clearly out of my depth. And then that's how it was, I don't know, again, in the Philippines, you start really early. You start school really early and start thinking about what you want to do. And I thought, that's a cool gig. I want to do that.
Okay, so I have the worst story to follow that with, which is that in high school, I saw the Christian Slater movie, Pump Up the Volume. And I thought, I want to be on the radio. I want to be on pirate radio and get people really excited. So you all know where the Philippines are. How many of you have seen Pump Up the Volume? All right, okay, so you see my inspiration. I did actually take that rather lame inspiration and get involved in a youth radio group in my hometown in Berkeley, California. And as one of the early things I did was an NPR project on my high school. My high school was incredibly diverse, but very segregated. The white kids didn't talk to the black kids. The Latino kids didn't talk to the Asian kids. Everybody was in their own, like literally physically different parts of the school between classes. And doing a story about my high school, I got to go ask questions of people that I only ever passed in the halls and never talked to. And it was amazing. I got to ask them questions and they would answer them. And I learned things about my school that I never would have, and my peers. And I thought, this is powerful. And so I went from there. But it did start with Christian Slater.
Wow, you guys are tough to follow. So I'm actually a career changer, and I sort of started on the other side of the media. Does anybody know the Food Network? Yes, okay. So actually that was my first job out of college. I worked as a production assistant in the marketing department and on-air promotions. So I eventually ended up writing and producing commercials for the TV shows on the Food Network. So that was sort of my in. But I had this project. There was a show called Iron Chef, and then there was Iron Chef America. And we ended up doing like these 60-second videos about people's own Iron Chef competitions. So I got to travel around the world and not around the world, around the country, and interviewed people. And I just really enjoyed it. Like I really liked being out in the field. I liked just talking to regular people. And so then I moved out to LA and started freelancing and got more opportunities to do that. And I was looking for a change, and one of my friends that I grew up with was like, you should go to journalism school. So I ended up doing that. So I moved back to New York and went to school out there. And my idea was I wanted to work at like 60 Minutes or a news magazine show as a video producer. And I took a radio class and I just kind of fell in love with it. And it's so intimate, and I still got to interview people. And that's the thing that I really love most about journalism, is being able to talk to people and get to know them and hear their stories and share their stories. So yeah, it's the best decision I ever made.
Such varied backgrounds. This is working, right? Y'all can hear me? Yeah, thank you all for sharing. So the next set of questions, I'm going to have one for each of the three of you. But as we sort of kind of think about the power of journalism to inform public understanding and really thinking about kind of the layers of storytelling from kind of the hyper-local to the state to bringing in global perspectives, each one of our panelists brings really a unique background and lenses to their reporting. So Stephanie, we'll start with you. You've got the mic. KUNC serves residents of Northern Colorado. I actually grew up listening to it. I'm from Fort Collins, so I'm super hyped to meet you. Yeah, Stephanie, so local journalism really plays a vital role in amplifying community voices, really at a hyper-local level. How do you approach uplifting local stories on issues that really matter most?
Yeah, let me bring up my notes here real quick. I think, so at KUNC, so we cover Northern Colorado, pretty much Denver North, and we're up in the mountain communities in the Eastern Plains. And it is a wide geographical area, and it is also so diverse. So I think one thing that we've really focused on more and really started to excel at is really kind of focusing more local and even hyper-local, and doing stories that are very specific to specific communities. And some of our most read, most popular stories are the ones that are very hyper-local. And then just to pivot back to the election, one project that we were involved in, well, actually, let me just start in saying that a big buzzword for journalists this election was like community engagement and voter-centered storytelling and reporting and putting the voters first as opposed to, just talking about the candidates and the races. So we were involved in a couple of projects, and one of those was Voter Voices, and Megan actually helped to run that. So CoLab and CPR were sort of headed up that effort, and it was more than 30 news outlets throughout the state put up a survey to ask voters the issues that were most important to them. And the top two were democracy and good government. And so all the data was shared, but also it was broken out by news outlet. So we really sort of focused on that and did some reporting. Our political reporter, Lucas Brady Woods, did some reporting on good government and democracy. So that was one thing. But then we were also part of another project through America Amplified, which focused on community engagement as well. And you could kind of choose sort of which, I guess, population of voters that you wanted to focus on. So we decided to look at young voters and the youth, or I guess probably under 25. So we partnered with Front Range Community College, and we ended up actually partnering with their student journalists, and they have a student paper called The Front Page. So we did a lot of collaboration with them as well. And in fact, we sort of combined the two efforts and did a story on when it comes to democracy and good government. We partnered with one of the reporters at The Front Page to talk to students and find out, are you going to vote? Why not? What are the issues that are important to you? And then we also did Lucas went on a couple of listening tours around the state. He went to some county fairs on the Eastern Plains, as well as up to Grand County, and just talked to voters and got really perspectives on both sides. And I think that is sort of where we seem to be moving towards, is to really find out, like, rather than telling people what we think they want to hear and what we think they want to listen to, is actually asking them. And I think that really showed up in election reporting this year, not only for us, but for other outlets across the state.
Thank you, Stephanie. Show of hands, folks in public health, you said the buzzword community engagement. Who's used that in their work? So I want you all to sort of think about the parallels between media and public health as we have this discussion. So Megan, you're next. CPR serves a broad and diverse audience across really urban, rural, and frontier communities across the entire state. How do you ensure you're reporting on complex topics like environmental justice, climate change, health equity, terms that can be perceived as charged, resonate with such very varied communities?
Well, I would say it's an ongoing struggle, and a process of trying to get there and not always getting there. And I'm sure we do lots of stories that some chunk of our audience wonders why they're hearing it. But one thing we've been doing a lot of is really trying to be in more places in the state. We were very lucky over the last decade to go through a period of real growth, and we used a lot of that growth to expand our footprint. So we have 2 reporters in Grand Junction now. We've merged with KRCC, the Colorado Springs base station that serves southeastern Colorado. And we're really just trying to be in more places in the state so that, because that's how you tell the stories properly, right? I mean, as a reporter, I love to go to a town I'd never been to before and do a story there. But there are real limitations to that kind of journalism, and it will be done better by somebody who's lives in that town or lives one town over. So we really are trying to get more connected to more communities. And even in the metro area, by merging with Denverite, we now have a hyper-local Denver outlet. And just like Stephanie mentioned, that taking those hyper-local stories often up to a state level, maybe with a little bit of a focus shift, still serves what I think is a universal feeling around the state, which is to be connected to the state of Colorado. People in the metro area want to know what's happening in the mountains because they want to feel like that's a part of their state. And so I think a lot of our state level coverage, we're trying to build those connections. We're actually sort of launching an experiment right now. We've had 2 reporters at the State House through session. Well, one of those reporters is going to be spending session mostly living in Carbondale. And so we're really going to push to, when bills come up in the State House, instead of just like being in the State House and hoping somebody from somewhere interesting shows up to testify and telling their story, we're going to try to take those bills and really tell the implications of them from a part of the state that is quite a ways away from where the policymakers are. It's a bit of an experiment. I'm really curious to see how it goes. But if it works, it's going to live up to this mission of really trying to connect the state, in my universe, trying to connect everyone in the state with the policies being made in Denver.
Thank you, Megan. So Luigi, you mentioned the Philippines. Having covered sort of the Philippines in a past career, how does your kind of international experience shape your perspective on journalism here in Colorado?
So I don't, show of hands again, let's do that. How many of you know how good you have it here? Good, I'm glad to know that. You have it very, very good. Sometimes I think that you have no conception of what it's like to be in a place where things are really, really bad. When I tell people that the United States is a great country and the systems that are working, they roll their eyes. They tell me, you're crazy. I'm not crazy. I've seen what it's like when the systems are not working. I've seen what it's like when the systems are in fact breaking down. I've seen the alternative to what the United States is, remains to be a great country. And I know what that's like. I lived that for almost 3 decades. I came here when I was in my mid-20s. I covered coup attempts in the Philippines, 2 wars. There's a communist rebellion. There's an Islamist insurgency in the south. This is a country that's fighting 2 wars at the same time that there's deep-seated nepotism, corruption in government. That's the kind of alternative that you're looking at when you're outside of the United States. And you might think I'm preaching, and maybe I am, but I do want to emphasize that you have it really good over here, and you cannot afford to lose it. And so when I look at the systems and what's going on, a lot of it's informed by my reporting and my background on how I actually learned journalism in the Philippines. In the Philippines, there are really no progressive, conservative, all kinds of political actors of all ideological stripes, if you will. You only have the cult personalities and a really messed up type of a democracy that's getting challenged by the military every so often. And the way I view journalism, and I think this is the right one, because journalism in the Philippines came from journalism in the United States. The fundamentals are the same, which is that our job is to watch what government does and how it acts and speaks on our behalf. If you're a journalist, and in my mind, if you're not doing that, and that is your job, that is your beat, you are falling short of what is expected of you. And what I mean by that is, we have governments, for example, let's just pick one city, big city in Colorado. Let's just say Denver. Denver is my favorite city. I actually live in Denver. Denver has real problems. It has a public safety problem. It has a crime problem. It has a spending problem. It has an illegal immigration problem. If you're from Arizona, you know that, or from Texas, you know that. Now you have a taste of it in Denver. Our job is to figure out what is happening and tell our readers exactly what's happening. And I do want to emphasize, it's really important for journalists to adhere to the standards that had served us so well for so many decades, which is objective, fair, balanced reporting with just a dose of skepticism when you're dealing with your local governments. And I think that is the kind of journalism that is going to serve us well in the long run. It has been tried and tested, and in the case of Colorado Politics and the Denver Gazette, it is working.
Thank you, Luigi. So this next set of questions, anyone can answer, and feel free to chime in. really thinking about, what are some of the health issues that you think are driving Colorado voters' decisions? And paired with that, sort of, are we seeing shifts in what's motivating them either politically or socially?
Want to take this?
Oh, wow. Okay. Okay. So I think one big issue is housing. And I think that the way that sort of ties into some issues is, Luigi had mentioned immigration. And I think, more people coming to the state. And I think another issue is people that are moving here for healthcare reasons. And you all know, working, I don't know if you guys work at CU, but gender affirming care and other things that people can't get in other states and are coming here. And I think that, as our population grows, the cost of housing has gone up. And I'm sure you guys all know too that, housing has such a huge impact on health, right? If you don't have a stable place to live, how are you expected to go to your doctor's appointments or, go find a job or all of these other things? So I think that is something that, that has been an issue and remains an issue. And even though I guess people coming into the state it's not growing as quickly as it has been. But I do think, just from reporting that I've done over the past year, that this isn't, the high cost of housing isn't just an issue here in the Denver metro area. It's an issue up in our mountain resort communities. It's become an issue on the Eastern Plains, mainly because they don't have, a whole lot of housing stock. So that's one thing I could think of.
Yeah, so, how many of you were surprised that Donald Trump won last month? Okay, good show of hands. How many of you were surprised at how widespread he won the race? Okay, now you got to ask yourself, who's your news source? Why do you believe what you believe? It's a really good question, because then the next question is, exactly what kind of views are you hearing? Are you absorbing? And are you believing? And I know we're going to talk about distrust in the media and in our systems. And if pretty much everybody in the room was really surprised at how big of a margin Donald Trump won, then there's a real disconnect between what you're hearing from your news sources, and I hope to God it's not Facebook or TikTok, but there's a real disconnect between your news sources and what's happened. And you have to ask yourself really hard questions. And if you are asking yourself those questions, journalists like me are certainly doing the same thing. There is and if we haven't recognized it yet, there is a real recognition that what we may be reporting on, what we may be telling the American public, isn't exactly squaring with what's happening, and that's a real problem.
So let's unpack that a little bit. That does tie well with the question that microphone is not working.
Sure.
Thank you. Oh yeah, that's much louder. So yeah, let's really dig into that kind of tension on skepticism in general of media. We live in a bizarre time where people are both sort of overly cynical about expertise, while at the same rate are kind of overly susceptible to misinformation. So this is a common challenge both in public health, especially in the wake of the COVID-19 pandemic, and for healthcare professionals alike. So how do you navigate this tension in your respective reportings?
Sure. Well, I think if any of us had the real solution to that, we'd be, I don't know, running a media institute by now. I think about it a lot, and I guess where I've come down to is my outlet is not geared to be solely fighting misinformation. If we were, that would be a full-time job of everyone in our newsroom. Where I see us falling is as we are a resource for the the starting to doubters. So we are doing a lot more explainer journalism than we did in the past. That was not, I think that wasn't really valued in journalism so much in past decades. Oh, well, you know, let's go and break a story. Let's not tell you how the thing works. Let's break something new. And what we're realizing is people need and want to understand how things work. They want a good explanation of things, not just the latest thing. So we're doing a lot more explaining because I think that builds trust with the audience. We're not just telling them, to use a public health example and not one from my newsroom, we're not just saying fluoride in water is good. The New York Times had a great, really long article about like, here's how fluoride ended up in our water. Here's what we know about what it means for teeth and dental health. Here is why there is concern over the amount of fluoride. And here's places where the debate has gone back and forth. We're giving a lot more context. And my hope is that kind of journalism catches somebody who saw the Facebook post or the TikTok that said, fluoride in the water is killing all your brain cells. And it's like, oh, is it? And there should be more out there for them to find that engages them and helps them understand it before they hit the rabbit hole. I don't have a lot of faith that once somebody's super down the rabbit hole, that traditional media is going to be what pulls them back out. But I think we can hopefully kind of stand around the edge of the rabbit hole and say, but first, come here and learn. So I don't know, that's my 2 cents.
So I just want to add, I think there's been a real shift or push to add media literacy, and to even have media literacy in, for students, for kids in K-12 and in higher ed as well. Because I think when people sort of understand, reputable media sources, sort of how to fact check things on their own, I think that just helps. And I think the sooner that you start learning and realizing, oh, okay, this website that looks, because there's websites that pop up and they look like a normal website, right? They'll pull stories in, and we've had stories, and I'm sure you guys have too, from your reporters that end up on these websites, and it's like, but wait a minute, they didn't credit us. They took what we wrote and shifted it a little bit. This website is owned by this person who has a very narrow viewpoint of what they're trying to get across. So I'm hoping that as people start to really kind of think critically about where they're going and where they're getting their news from. And as I mentioned, there's such a push on media literacy, and there's a lot of nonprofits that have popped up too to help people understand and to kind of basically these websites are sort of doing kind of the fact checking and being the watchdogs of bigger media outlets, to kind of where you can look and see like, oh, okay, how trustworthy are they? Or how much, on the right are they, or how much on the left are they? So I'm hoping that continues.
So I think the real problem is that, the latest Gallup survey on trust in the media put us down below Congress. Before, it was second least trusted group of professionals, reporters, and then Congress people. And now it's Congress people and then journalists. And that's a real problem. If you don't see that as a problem, I don't know what to say. To me, that's a real problem. Trust in the media has plummeted. It's been plummeting. It's been going on for a number of years. Now, I think one of the problems is that we decided that we can condescend to the American public, that we are smarter than they are. In fact, the American public, by the way, again, the greatest country, wealthiest country in the world, is quite sophisticated. They can tell, sorry, am I allowed to say bullshit? They can tell bullshit from afar. They can smell it. They know if you're putting your thumb on the scale and you're trying to preach to them, and you're trying to manipulate them, and you're trying to get them to adhere to your viewpoint. To me, that's a problem. The issue, I think, for most journalists is that we decided, many of us decided, we're going to take sides in the ideological wars going on in our country. So instead of being objective, fair-minded observers of what's going on in our society, we decided to be combatants. We decided to be ideological warriors, fighting people's philosophical battles on their behalf. And once you did that, in my mind, you cease becoming a journalist. You just became an advocate. You're now a partisan. You're now an ideologue. The problem is, we told the American public we're going to be objective, fair and balanced from Fox News. Of course, you know that. Take a moment and watch MSNBC or Fox News and CNN, and you tell me if they're actually fair and balanced and objective. I will tell you they are not. And that's a real problem. You can set up your journalism endeavor by immediately telling the public, I am not going to be a fair and objective and balanced journalist. I am going to write with a certain viewpoint. That way, you're at least being transparent to your audience. The problem is when you promise to them and you commit to them that you are going to be objective and you act exactly the opposite way. When journalists take sides, and they do this on all sorts of ways, by framing the language a certain way, by their selection of the stories. Eugene Robinson, great columnist from the Washington Post, came to Denver 2 years ago, and he said, what do you call it? The big lie? And he was talking about claims that the 2020 elections were rigged. Do you call it the big lie or not? If you called it the big lie, half the country is going to be mad at you. And if you don't, half the country is going to be upset at you. How do you deal with that as a journalist? He didn't answer the question. He just posted. I think the answer is quite simple. Instead of labeling things, election denier, conspiracy theorist, pinko, nanny state, pink-haired communist, pick any one of these labels. Instead of doing that, why don't you describe exactly what happened? Tell the people what an election conspiracy theorist or election denier actually is. It's somebody who believes the 2020 elections was rigged and that Donald Trump actually won the elections. By framing it and objectively trying to describe it like that, you are giving your readers, your viewers, your listeners, a more objective assessment of what happened rather than a label. So language framing is problematic on multiple levels of analysis. Story selection is problematic. Look, if you're only writing about environmental justice every day for 1 year, what does that, how does that make you an objective journalist? If you're only writing a story from one point of view, and no matter how straightforward your story is at the end of the day, it's only one subject, it's only one framing, that is problematic. And I think what you need to do as a journalist, and by the way, if you're not subscribers to any of our, you should really subscribe. I mean, you should, I'm just saying, if you're not subscribers, we need your money. Okay, did you hear that? We need your money. We need you to sustain our operations. Journalists, I think, need to take this to heart. We got to stop being conservative journalists, progressive journalists, woke journalists, whatever label you have. Just start acting like a real journalist.
Thank you, Luigi, and thank you, Megan and Stephanie. On this notion, the three of you have mentioned alternative media sources, whether it's social media or TikTok or what have you. We're in an era of podcasts and TikTok and all these influencers and the bro influencers, the Joe Rogans those kinds of guys online. If you know what I'm talking about, you know what I'm talking about. So how do these podcasters are able to captivate audiences for 2-3 hours at any given time at the same rate, conventional media is putting out content and often competing for attention. Do you see, there's a couple questions here, and feel free to jump in on any of these, but do you see a role for media outlets like all of yours to engage with or complement or sort of counterbalance these sources? Does Colorado need a Joe Rogan? And then
Stephanie, that's a question for you.
I don't think we need another Joe Rogan. I don't know. That's just my opinion.
he's a one of one.
I think there's a lot of shouting. Like I feel like people shout a lot, and somehow they feel like if they shout, then their opinion has more validation. And I think it kind of leads back to just wanting to get clicks and for things to go viral. And I've noticed that across a lot of different platforms. I like to watch sports. I watch ESPN sometimes, and I'm like, why is this guy shouting at me? It's just weird. And then back to Luigi's point about media outlets being fair and balanced, and especially with our like 24-hour news networks, is I think people get really confused by analysts and people that have opinions and journalists, and the line has been really blurred to our detriment, to those of us that are just like, we are journalists. What Luigi was saying, like we want to cover things truthfully and factually and be fair and balanced. And I think when all of us get lumped together, then it gets confusing for people. And I also think too, with social media, it is the barrier to entry to becoming a journalist is non-existent. And when the Boulder shooting happened at the King Soopers, there was somebody who was live streaming what was going on. And we were sitting in our newsroom watching what was happening. Or actually, I guess we were at home because that was during COVID. But it was really interesting to watch somebody do that. And for lots of people, I think thousands of people were watching this person. So I think that's what makes our job really difficult. And I think it's kind of going back to the media literacy part, is how do we counteract somebody who has a podcast and can just sit there and talk. And I think I read something that they're kind of moving away from having guests on a lot of these podcasts to more sort of people just monologuing for 45 minutes. So yeah, I mean, as a media professional, it's really hard to combat that, because I guess I could have that platform, but I would never do that. I would never have a podcast where I just sit and talk at people for 2 hours. Like, that sounds horrible. So yeah, no, I mean, it's a big challenge. And we, of course, there's a lot of media outlets that are on all of those platforms. There's a lot of outlets that are now on TikTok. We're not yet on TikTok. We don't have the staff for that, but doing more things on Instagram, just trying to meet people where they're at, where they're getting the news from, especially, the younger generations are using those as well. So, I mean, I think we have to evolve and we have to adapt and we have to go to where the people are.
One thing that I think is like very scary for those of us who work in traditional media, and also probably all of you trying to get public health messages out, is that I think the real guiding principle of today's like information landscape is you have to be more interesting than you have ever had to be before, because there is so much competition for people's attention. And we're seeing this in public radio. Like, we've been the same thing for a long time, and it's great for a segment of the population, but there are a lot of people who aren't engaged by it anymore, who would much rather hear somebody talk to them briefly about it on TikTok, or listen to a podcaster talk about it for 90 minutes or an hour, 2.5 hours. And really, I think the challenge that we all face is we have to get better at getting people's attention. I think ultimately that's good. It's bad because I might be out of a job if I can't figure out how to do that, but it's not inherently in itself a bad thing that the world is full of really interesting things that people can consume. And I think also we overstate how much a platform change is a message change. Joe Rogan, to me, feels so much like Howard Stern. Like, my husband loves Howard Stern. We used to listen to him on satellite radio all the time. Not a big Howard Stern fan, but boy, do I appreciate what that man can do. He just gets in front of a mic and he is interesting to listen to for a really long time, even if you don't like what he's saying. Rogan's the same way. I listened to the Rogan Vance interview and I was like, oh, this is really just like good content. These guys are entertaining. And so I think we need to be a little less scared of podcasters and of opinion podcasters, because they've been out there. I mean, what was Rush Limbaugh doing 20 years ago? He was doing this on the radio, what people are doing on podcasts now. And so I think in traditional media, we're just in a landscape of vastly enhanced competition. And I don't know if that means that we get much better at social media and podcasts, or that we start connecting with the people who are really good in that realm and trying to get our information to them so that when they're talking for 90 minutes, the information they're using is coming from good sources. I don't have a good answer on how that nexus happens, but I just think we're in a moment where we can't be boring. And that's hard because news is hard to make. And so sometimes you just kind of give up and be boring about it.
So these are podcasts that last between an hour and sometimes 3 hours. There's a big audience for these podcasts. And again, you got to ask yourself, why are people listening? Why are they spending 3 hours on this podcast? And think about this juxtaposition. Interviews on TV used to be what? Back in the day, 3 minutes, 7 minutes, all right? Back in the day, decades ago. Then it went down to like 4, 3, and then now what is a good soundbite length?
On TV, I mean,
On radio.
in a radio feature, you'd be between 12 and 25 seconds, but in a piece that had a whole bunch of sound bites.
Right. And that whole piece can be between 2 minutes, 2 minutes is long, so, 2 to 7. All right, so think about that for a second. Radio 2 to 7, sound bites 20 seconds, something like 30 seconds, maybe more. And if it's a full-length TV show, good 7 minutes is really long. I think there's a real hunger from the American public for long-form conversations that really dig into deep subjects. And I'm not going to ask you if you listen to Joe Rogan because your seatmate might elbow you, but if you do listen, or if you get the chance to listen, these are long-form, often in-depth conversations about any one subject. It could be physics. It could be the black hole. It could be string theory. And they're spending 1, 2, or 3 hours. And I think that's what you're seeing, and that's what the public is demanding. It's intellectual conversations, philosophical, deep philosophical moorings into the origins of the universe, and people are glued to it. And there's a reason for that. Again, I tell you, the American public is quite sophisticated. They know what they're doing. You can't condescend to them. Do we compete with those? Quite frankly, I don't really care too much if they're there or not. I know what I need to do. I know what my job is. My job is to watch the mayor of Denver spend our money and then tell us whether it's a good thing or a bad thing, and try to spin all of us here in the room that it is a good thing. That's my job. And I think if I'm doing that correctly day in, day out, and I have a body of work that can show it's been done consistently and it's been done better than anybody else, I will have readers for my newsroom. And, when the time that doesn't happen anymore, then maybe, it is probably the end of journalism. Maybe it morphs into something else. But for now, it's a critical juncture for us journalists. We have the opportunity, not necessarily to compete and take that audience, but we have the opportunity to show the American public that, our work is dependable, it's reliable, and it's truthful. The truth is really difficult to get at. What's happening in reality is really difficult to get at as a journalist. You can only write the best that you could write at the moment that you're writing it. And by the way, now, you're constantly rewriting it because you're constantly getting new information. But if you're not writing something as close to reality as possible, it's going to be a problem because reality is going to hammer you flat. You can't fight reality. It is what it is. And so if your journalism is as far away as what's happening to the American public as possible, you are not going to survive.
Just real quick, I just wanted to say, so Luigi, you're talking about podcasts that last, an hour and a half, 2 hours. But then you've got TikTok and somebody wants their news in 20 seconds. So, we have limited resources in our newsroom. So how do you produce a podcast where someone is talking for 2 hours, but then also do this other thing where you have to get it in really short? So I think that's another challenge that we face too.
So we're going to do a lightning round, just question, just to end on a positive note. We've discussed some challenging issues today, and I appreciate the three of you and your insights and the work that you're all doing. I also want to make sure that we build in enough time for questions because I'm sure you're all eager to ask some. So the final question, lightning round, quick thought. When you think about the role of journalism and your role in our state, and the connection that you have with your readers and your listeners, what gives you hope or inspires optimism moving forward?
So I think going back to what I said at the beginning, community engagement. And I think the push to really get out and rather than telling, our listeners, this is what you should be hearing, but reacting to their needs and what they want to hear. And I think that will help solve some of these issues that we're facing in journalism.
I think for me, it's the fact that people still want news and stories. We may not have figured out how to get it to them in the form they want it right now. I mean, we are, especially in radio, in a big moment of disruption because audio storytelling has gotten very democratized. But the human hunger for the fundamental core of what we do is so strong that all we have to do is figure out how to get it to them the way they want it, and we're still there and still relevant. So to me, that's the exciting thing, is that what we do is still needed. It's just we have to figure out how to do it in the way that a technologically disrupted public wants it.
Yeah, I told you that I was a young, idealistic, stupid man, when I went into journalism, and I have this very romantic view of my profession. And unfortunately, I still hold on to those views. And so I have nowhere else to go. And I'm kind of stuck in the profession that I am. I got to make this work. Only half kidding there. The thing is that journalism is a noble profession. If there are no journalists, your country is going to really suffer. And I mean, your country, any country, the United States, the Philippines. There's our democratic institutions, I don't know if you believe me or not, are actually strong in the United States, but they can only stay strong for so long. There's a veneer that separates order and chaos. And if journalists are not around, and I strongly believe that journalists are the vanguard, we do a crucial job to ensuring that we have a robust democracy. I think if we're not around, the storytellers are not around, somebody's going to puncture a hole into that wall, and before you know it, this bulwark of democracy that we have is going to come crashing down, and chaos is going to come rushing in. That's going to be a big problem. I'm very optimistic. I'm very hopeful. Also, because you said you're going to subscribe to my newspaper, so that's good.
I want to just pause and give a round of applause to our journalists before we dive into questions. That was wonderful. Thank you all. All right, I saw a hand raise. We can dive into Q&A. And we do have a mic runner, Maggie. Thank you.
So you're speaking to a room full of people who care about public health, and I'm wondering, please directly give us advice about what we should be thinking about when we're trying to communicate. Or another way to say it might be, what do you wish that we would do differently?
Ooh. Only because this is advice that I'm not taking for myself, but should be. I don't know, how much are you guys looking at where the bad information comes from? Like, and not just sort of once it's out there, but like, I mean, there's an ecosystem on our Facebook pages and TikTok and everywhere of people, spreading bad information. And I think one thing that all of us probably need to learn from is what makes that so engaging to people, and then steal their techniques, frankly. I say this as someone who doesn't have the time to do that, but I wonder, there are things to learn, I think, from the social media ecosystems that spread misinformation that I'm sure we could steal to spread better information.
I would say go to where you're least comfortable. If you're kind of afraid of the bras, the podcasters, go to them, reach out to them. I heard, once a long time ago when I was in the Philippines, the Catholic cardinal, the head of the Catholic Church in the Philippines, was asked about graft money. Basically, this is money from an illegal gambling that goes to the church. And he was asked, why do you take this money? What's wrong with you? You're supposed to be a Catholic cardinal, a priest. And he said, if the devil gives me money, I will take it and use it for the poor. I always think of, I cannot escape that thought that you got to go where you're least comfortable and try to do good where you can. So yeah, if there are those places, TikTok, if you're on Joe Rogan, you're suddenly talking to millions and millions and millions of people.
Stephanie, do you want to?
John, I think you had a question.
Or need to have a more neutral stance. And one of you just made reference.
Can you speak closer to the mic, sir?
Yeah. You made a point that journalists need to be either more transparent about their non-neutral stance or to be more neutral. And I'm curious, because we're about to embark on an administration that was logged in as telling 30,000 lies when it was in power previously. And there was a lot of controversy in journalism about the use of the term lie. And I'm wondering how you all reflect on that. Is that being objective to say that's apparently patently transparently false, i.e. it's a lie? Or is that playing into a political stance?
All of those things, unfortunately. All of those things. So here's the thing. Often you have to be really nuanced when you're reporting. Because when you say something is a lie, who's saying it is a lie? Is it you who's saying it? And if it's you saying it, why do you think that you actually have the knowledge, the right to say it? What makes you the ultimate source of what is a lie or not? Let me break it down a little bit more. I don't have a problem quoting somebody saying this is a lie. So you say you have a politician X saying that's a lie. That's not a problem quoting that in the newspaper. But if my journalist, if me who's writing it says, basically, that is a lie, is that coming from me? Or is that coming from someone else? That's a problem. You got to think about that. Because if you say something is a lie, you're making yourself the authority for what is a lie or not. And again, I think the journalists need to assume this profession with a certain sense of humility that they don't know everything. Look, I came to Denver 3 years ago. My knowledge of Denver out of 10 is probably 3.1, whereas before it was 1.6 or something like that. I don't know everything. And I cannot assume this role as a journalist with this notion that I know what is a lie or not. What is better is to describe it as a lie and attribute it to whoever is saying it. You see, attribution in journalism back in the day was very, very important. Today, yeah, journalists tend to gloss over it, but I think to me attribution is very, very important because it tells you who the source is, and the American public can then assess whether that source is credible or not. Again, give it to your readers, tell them what happened, and let them decide.
I'm wondering if there's any questions online that we can take. Just want to be mindful of our online audience. Yeah, Christy. None yet? Okay.
Oh, wow. Okay, those
We've-
guys online, they need to pick up.
We've had a
Yeah.
couple of questions back here, so.
Hello, everyone. I think it was Stephanie that mentioned media literacy. So yeah, this is a question about that. Obviously, I don't work in media, but as an outsider looking in, I think one of the reasons that the Joe Rogan podcast is so successful is that it's just almost like talking to, it's just like a very informal conversation with people. And then I think that's why it's gained so many listeners. And I think it goes back to language accessibility. So when major media outlets discuss all these issues that are going around the world, I think that there's a disconnect where people don't feel like you can listen to it, but maybe it's not as accessible, like in terms of language. And that's also a major barrier in healthcare that we see with vulnerable populations and ties to media literacy. So how do you guys feel like moving forward, media literacy should be targeted not only to younger generations, but I feel like older generations also need media literacy training. I'm Latina, I'm Puerto Rican, and I have a lot of older generations in my family that get their news from Facebook. And so I just see the disconnect sometimes, not only in younger generations learning media literacy, but also how do we cover everybody?
Yeah, that's a great question. Wow, it's a big question too. I was just thinking, you mentioned sort of your older family members. It makes me think of an ethnic media that's based in Aurora that sort of covers the Denver metro area that I interviewed. And this woman, she's it's for the African immigrant population, and around COVID-19 and all the misinformation and the disinformation in trying to combat that. And I think it's really important to realize that there is a role for all different media outlets, and they are all important because they reach different segments of our population. And so if your aunties and your grandparents, whatever, if that is where they are going to, then I am sure that there is a media outlet, and it may be small and it may be targeted to them, that that they can turn to. And I think it's probably a responsibility of bigger media outlets to sort of help support them, because we're all trying to reach, especially in public radio, we're all about like growing our audience and how can we find our way into these populations of people that are not traditional public media listeners. And a great way is to work with smaller public medias, ethnic media outlets, the ones that actually are in those communities. And it can be a win-win for both outlets. And then as far as I think your first part about Joe Rogan and being entertaining, and I mean, I don't listen to his podcast, but I'm sure he must be entertaining because he has, so many listeners, and there's a lot of other people out there that are very entertaining. I think the problem is that when you think that what they are saying is fact as opposed to opinion. And I think that that's where, as I mentioned earlier, the line has been blurred when it comes to journalism. And I'll tell you, like, the New York Times has made some serious blunders with putting out podcasts and other stories that have not been fact checked properly. And so when the biggest newspaper of record in this country makes a mistake like that, that's a big deal for the rest of us in the industry, because if you can't even trust a media organization like that to fact check and get their facts right, are you going to trust, the Denver Post? Are you going to trust the reporter at KUNC? So I hope that answers your question.
All right, I think we might have time for one more question. So make it good. Yes, yeah.
Oh no, I have the mic. Is that okay?
Go ahead.
Mandy Ashley with the Aurora Health Alliance. Thank you so much for being here. If you guys look around the room, you'll see a bunch of well-meaning but not horribly diverse people involved in public health. But if you look outside this campus, you'll see an extremely diverse part of the metro area, part of Aurora. I'm just wondering how you would recommend public health outreach diverse communities. All of us are mostly reading the news, but the populations we're trying to reach might not be. Thank you.
So Aurora, right? Aurora Health Alliance. Yeah, that's Aurora, as you know, is probably the most diverse city in Colorado, right? It has the most diverse in terms of spoken languages in the city. And you do have to reach people where you can reach them, especially when it comes to public health. Let me just step back really broadly about podcasts and other forms of media. Just really quickly, and this might answer your question. Reading is really hard, right? It takes an inordinate time to concentrate, read, and you take it for granted because you've been doing it for a while. But reading is difficult. Watching, less difficult. Listening, well, you can multitask and listen at the same time. And we won't know this for a while, but we might be at the verge of a revolution to the tune of the Gutenberg press revolution from hundreds of years ago when it comes to the media landscape. Because with podcast, you can be on your bike and listen. You can be in your car and listen. And it's on demand. You can do this at any time that you want. And so if you can figure out a way to harness that and reach your diverse audience in Aurora at the level that they will understand, which means potentially taking that information in their, most likely in their own language and breaking it down, I think that would, just conceptually, think about that.
I know we're tight on time, but to add one thing, I'll be honest, I'm really realistic about the fact that when I put a story on the radio or on the CPR website, it's going to a very tiny sliver of the population. I think one thing I see, to go back to what Luigi said about public trust in media being very low, I think part of it is thinking of where you fit in an ecosystem of getting your good information to the trusted person who gets to the person who needs it. And that trusted person is apparently not going to be us, might not be you. Maybe it's the nurse they see in the clinic. Maybe it's their kid's teacher. Maybe it's the principal who talks to them if they come to to the information night at the school. I think we have to see ourselves as not getting our information to everyone, because we live in this very fragmented, slivered media world, and it's just going to get more so with more choices out there. I think the idea is to have really good information and figure out who the people are who talk to the people who talk to the people who get to the people who need your information, and getting yourself into that chain, which I'm betting that all of you are actually probably pretty good at and have been thinking about and working on, because you face the same problem we do. But I think, honestly, it's a fool's errand to hope that things would go straight from this room to the person on the street who needs it. It's more being a part of a chain and being a strong link in a chain and getting to the next person and helping them get to the next person.
All right. Well, please give a round of applause to our speakers again. Thank you for your insights. I'll just end on a note of one of my favorite quotes from Khalil Gibran, which is, "Say not I found the truth, say I found a truth." And ask the critical questions. So now we're going to transition to the legislative preview with Joe. I do invite you all, so we're not going to have a break in between. Correct, yes. So I invite you all, stand up and stretch in this next 30 seconds, shake it out. Do what you need to do, but we're immediately going to go into this next session, and you're in for a treat.
As our reporters leave, I just want to, or our editors, I guess, leave, I just want to say thanks again. Joe Hannell, I'm the communications director at CHI, but I was in journalism for a long time before I came to CHI. I actually reported at the Capitol with Megan. I do not envy the job that they have had over the past several years. It's a no-win situation for them. I'm glad they're all out there, though, keeping us informed. Give you a few more minutes to settle back in. Okay. How's that? No? All right.
Okay, everybody, we're gonna bring it home. So please come on back in. We have our legislative preview. No pressure, Joe. You and Lynn, you totally got it. All right.
All right, thank you so much. And if you're in the back, we do have a lot of seats in the middle. You really don't want to duck out early for this. This is our annual legislative preview. I am Joe Hannell, Communications Director at CHI. I've been giving this very presentation since 2014. And if you're one of the people who's been to Hot Issues before, you know that there's a bit of a template for these. I get up here, we make some jokes, show some clips from bad movies like Sharknado, we did one year. We talk about the budget and how there's not enough money. We talk about the bills that are coming up, and that's that. This year's going to be a little bit different because, this year is a little bit different, right? We're still going to talk about the budget and how there's not enough money. We're still going to talk about legislation that's coming up. But what we're really going to try to do is construct a mental model or a policy framework for how we can think about making policy in the state here in the next year or 2 or 4 years. So that starts with looking at the tools that we have available to us. I'll talk about 3. First, the nature of the United States itself, a federal republic. Second, the leadership that we have here in the state. And third, resources, which is money. And then we'll talk about what we can do with those tools, what we can build, the work we can do. We're going to focus on 2 areas, 2 very broad areas right now. First is protecting the vulnerable among us, and then carrying on with all the priorities that we've created over the past, created together as a community over the past several years here. So let's start out with those tools and federalism. So this is where federalism came from in the United States. This is 1789. This painting depicts when a bunch of white men got together for a knee-high stocking show. And also, I did make a joke, I'm sorry, also produced the Constitution of the United States. I see George Washington there. Can anybody else, most of the faces I cannot identify. Does anybody see one? Ben Franklin, yes. Oh, Jefferson, yeah, and I think Alexander Hamilton might be in the middle there. He's not singing though. I don't know what's going on. What the federal structure of our country means is that power is shared at multiple levels, specifically at the national level and the states. The national government is supreme, but there's a lot that a state can do in a structure such as this. And in fact, there's a lot that Colorado already has done over the past few years, or actually many years. Let's think about essential health benefits. This was a really famous part of the Affordable Care Act, which passed 10 years, or went into effect 10 years ago. But Colorado already had essential health benefits in its law. So things like prescription drug coverage, hospital coverage, ambulatory care, that was all put into federal code in 2014. But Colorado had it, and it remains there. Speaking of the Affordable Care Act, there was a lot that law left up to the states if they wanted to take advantage of or not. Colorado went all in. We expanded Medicaid. We set up a health benefits exchange, Connect for Health Colorado. Fun fact, I used to get, when I first started at CHI, I would get phone calls looking for the Connect for Health executive director because we incubated Connect for Health at CHI, and apparently I inherited her phone number when they struck out on their own. So another example here is when the national law, the Brady Bill, went into effect. It required like a 5-day waiting period on firearms. Colorado circumvented that as like a very pro-gun rights state and created an instant background check system. Set it up, spent money on it. Now the politics have changed in the intervening years, and we now do have a 3-day waiting period. But that is another example. And then in this election, just last month, Colorado voters put into our Constitution the right to same-sex marriage and to abortion rights. So there's a lot. There is a lot that the state already has done, and probably much more to do. And we'll do that with, through leadership. That's our second tool here. We're going to start out on this section with a quick look at the election. Republicans have been in the wilderness in Colorado for several years, but they did make some modest but noticeable gains in the past election. Specifically, they picked up the 8th district congressional seat just north of here. I think that's north. And then in the state legislature, they picked up 3 seats in the House. Democrats still have a really big majority, but it's no longer a supermajority. And that means that Republicans will get a few more seats on some committees, so the partisan balance on those committees won't be quite as lopsided. And it's just another, it gives the minority party a little bit more influence over legislation. In the Senate, each party gained a seat and lost a seat for a stalemate. It's still 23-12 in favor of the Democrats. Again, just 1 seat short of a supermajority in that chamber. And then finally, I didn't want to talk about leadership and say it's, okay, sorry about that. We have those 100 members of the legislature, but there's 3 power centers among them that I want to look at. First is somebody who's not a legislator at all, Governor Jared Polis. Second is the Joint Budget Committee. These are 6 members, 3 from each chamber. There are 4 Democrats and 2 Republicans representing the majority and minority. The session hasn't even started yet, and they are already really butting heads with Governor Polis over some of his proposals for where money should be spent and shouldn't be spent. Specifically, the JBC has been really trying to increase pay for providers in the Medicaid system and also increase funding for education, from kindergarten through college. And they think there's not enough for any of that in the governor's budget. And then finally, we have chamber leadership. That's personified here with our new Senate President, James Coleman, and Speaker of the House, Julie McCluskey, who's been in that office for a few years already. Over the next 4 months or so, these 3 power centers are going to interact, and out of that will come the state spending plan, which is the most important thing that the legislature does, even more so this year. And then, yeah, I didn't want to say we're just looking at these elected leaders and powerful people. Colorado really has we're blessed with a health policy community that is well resourced, and it's big. If there's a problem, there's a group working on it. So leadership is everywhere. All right, I'm going to take a sip of water because we're getting into the budget. And final tool in our our policy framework is resources, which in Colorado is the state budget. It's a tool that I'm afraid is a bit rusty and brittle at the moment. Before we get into the numbers, just thought it'd be useful to have a timeline of what we talk about when we talk about, oh, the JBC is working on the budget. So it starts November 1st, where the governor submits his budget proposal to the Joint Budget Committee. And then those 6 people hold briefings and hearings about each state agency or each department one at a time, and then call in the leaders of those departments to justify their budget requests in a hearing. The legislature is going to convene January 8th, and in a matter of a few weeks after that, probably, they will be looking at adjustments to the current year's budget. That runs from July 2024 to June 2025. This year, that's called supplementals. This year, we might be looking at negative supplementals. The simpler way to look at that is a cut. After that, they turn back to the 25-26 budget, which is going to start next July 1st. And they do figure setting, which is what just putting pen to paper and saying, this agency gets this much money for this specific purpose. They go back and forth with some of the agencies if the agencies don't like the way figure setting's going. But out of that, toward the end of March, will come a balanced budget. The state constitution requires the budget to be balanced, and the JBC will create one and put it into what's called the long bill. That's the budget bill. It'll probably have a dozen, 2 dozen, I don't know, other bills that go along with it, but the long bill is the star of the show. That is the state spending plan, and each chamber will debate it for a week. And if you don't have an item in the budget that you want, this is your last chance. It's not a great chance, but you can still get an amendment to the long bill. And then it'll be, if both chambers pass it and the governor agrees with it, then there you go, that's the budget. So let's get into a little bit into the numbers right now. If you walk away with any one takeaway from this whole presentation, it's the budget's tight. We are hearing that there is no money for new bills, and that rank and file legislators are being told not to introduce anything that spends money. The legislative lingo is anything that has a fiscal note. A fiscal note is like, it's a 8x11 piece of paper that's an analysis of how much money it would spend. If one of those gets attached to your bill, we're hearing that bill is going down quickly. And the budget is also constrained by various factors, one of them being the state constitution. And I want to get into that a little bit right now. So you've heard people say we're after several years of like relatively plush budgets with pandemic relief funds, that we're back to tight budgets. And that is true, but it's a different kind of tight budget this time around. So when I was a reporter at the state capitol, we had the 2008 financial crisis, and that left a hangover over the state budget for years, where the budget was really tight. Revenue was down because people were out of work and they weren't paying taxes. At the same time, people rely more on government services during a recession. So it's out of balance. Something's got to go. That's your classic budget crisis. This year, it's a little bit different. Scenario 2 here, revenue is up. The economy is doing quite well. Thank you very much. Expenses, though, are also up, and especially in healthcare, in Medicaid. And then Colorado, unique among the states, has this thing called the Taxpayers' Bill of Rights, which is, well, it does a lot of things. But the big thing it does here is it's a revenue limit. It says the government can't keep revenue over this predetermined limit that has to do with population growth and inflation. So it's not like a good economy is going to save you from this, or it's not like we can just say, hey, let's raise fees on vaping and or on marijuana sales. Any fee that you raise is just going to have to get, it'll be over the tabor limit, and it's going to have to get refunded back to people. So that's the situation we're in. We have too many expenses for what the law allows us to have. Having said all that, here is the budget the governor proposed, and in the next 4 months of negotiation and everything, yeah, there are going to be some important changes, but what comes out is going to look a lot like this. That's just because the big expenses are what they are. This is total funds. We've got a $46 billion budget. Healthcare policy and financing accounts for more than $17 billion of that. That's the Medicaid program and the other programs within HCPF. Then the next biggest department is K-12 education. And then we see, oh, that's in gold, higher education in the light blue. And this is total funds. What the legislature really has control over is the general fund. These are state tax revenues that go into the general fund. And again, it's the same big departments. HCPF is the biggest. Then we have K-12 education. We've listed higher ed and human services here, each around $1.5 billion. The little tiny orange sliver you might not be able to even see is Colorado Department of Public Health and Environment. That's public health, right? It doesn't get a lot of that discretionary general fund budget here in this state. So that budget, as we've said, is out of balance. There's too much spending for the revenue available. So to get to a balanced budget, what the governor's recommended is, well, there are several things. I want to highlight two. One is a cut in the rates that Medicaid pays providers, or some providers. This is after year of the JBC trying to raise Medicaid provider rates, 1% at a time, 2% at a time. What the governor's proposing is that anything that is above 95% of what Medicare pays, then they'll cut the Medicaid rate back down to that 95% benchmark. JBC doesn't like it at all. And then the other big item I want to talk about is Pinnacle Assurance, which is a state chartered workers' compensation company. The state set up this company more than 100 years ago, and it has grown to be a big player. It is quasi-public, quasi-private. It's this weird gray area that exists in. What Governor Polis is proposing is to privatize Pinnacle, use the proceeds from the sale to backfill the budget over the next several years. A couple risks to this approach. One is that you can only privatize a century-old company once, and that if down the road there's another even worse crisis, that option is foreclosed now. And second is that if legislators don't go for this, then we're looking at another $100 million that we have to find for this year's budget, and next year, and next year, and next year, and so on. So these balancing options are going to be really a lot of the discussion over the budget in the coming year. And finally, I want to look at federal funds in the budget this year. We usually don't talk about federal funds at Hot Issues in Health because there's just not much to say. They come in from the federal government for a specific purpose. The legislature doesn't have much control over it. But now, obviously, things might be changing quite a bit in Washington. I don't expect there's going to be changes in federal funding this year, but once the Republican majority in Washington gets a chance to write their own federal budget, then we could be having a very different conversation this time next year. So this graph here shows Colorado state departments by the percentage of their budget that is in federal funds. You see, military and veterans affairs is most of it is federal funds. That's basically the National Guard. And you think healthcare is expensive, try buying a fighter plane. That's where the federal support comes. Then it's healthcare policy and financing, more than half. It is, and that's basically our Medicaid program. And then Department of Labor, that is mostly unemployment insurance. Now, here's raw dollars in federal funds. We get $13 billion from the federal government each year, and it goes to really two places: Medicaid and everything else. Almost $10 billion in Medicaid funding. And then, so you see if there's even a 10% change in that, then we're talking about $1 billion. Not really kind of an insurmountable problem for a state the size of Colorado. Okay, I want to regroup a bit. We've talked about our tools, federalism, our leadership, our financial resources. So now let's get to the second part, the work that we can do. So my colleagues at CHI, Rachel in the front row and Gerardo somewhere in the back, and we've been talking to a lot of people around the state over the past few months about what they're working on and what we can expect to see. This is the part of the presentation where we talk about legislation coming up. If there's more out there than we're going to be able to fit in here. If you don't hear something, it doesn't mean we don't think it's important. Quite the contrary, if there's something that you're working on and I don't talk about it here, when we have our discussion a little bit in a few minutes, please tell us all about it, okay? But the first, we've put what we've heard into two themes. First, protecting the vulnerable, and second, carrying on with our long-term priorities. First, with protecting the vulnerable. The first group that I'd like to talk about is transgender people. The past few years have seen a lot of culture war, vitriol thrown at this group. There's everything from, a lot of states are passing bills, everything from telling them what bathroom they can use, what sports they can play, what medical care they can get. So, actually, I want to back up there. Colorado's become a bit of, it's become a place where people can go to seek gender affirming care while other states are banning it. There are actually, Human Rights Campaign says there are 26 states that have laws or rules against gender affirming care for people under 18. Colorado did the opposite. A few years ago, the legislature passed a law that said gender affirming care is a right. This year, what One Colorado, an advocacy group, would like to do is add gender affirming care as a required insurance benefit so that there's a way for people to pay for this and cost isn't a barrier. This will probably put our governor in a bit of it'll give him a tough decision because in addition to being an LGBTQ advocate, he also really does not like insurance mandates. His whole program in healthcare has been focused on lowering costs, and insurance mandates tend to increase costs, if ever so slightly. The second issue here is provider availability. Because Colorado does have these legal protections, it's become a place where a lot of people from out of state are seeking care. And we've seen demand for Colorado providers go up by or double in the past couple of years. Now, what we're talking about here is not needing to add new surgical centers and specialists. This is, for the most part, or the biggest, most common treatment is hormone replacement therapy, and that's a primary care issue. So there might not be legislation about this, but there might be more efforts to try to get the word out among primary care providers, train more of them up, get more of them willing to provide this type of care. Our second vulnerable group is immigrants. Almost 1 in 10 Coloradans is an immigrant. Shown here on the with the different colors. Gold is about 5% of Coloradans are foreign-born U.S. citizens or immigrants who are now U.S. citizens. Another 2 represented in the orange there are legal permanent residents. And then in the green is residents of Colorado who are undocumented. And that is the group that has really attracted the most attention during the presidential campaign, with the president-elect saying he's going to deport everybody who is undocumented. It's not the only targets of this policy, but the first. Now, we talked to the Colorado Immigrant Rights Coalition about this, and they say they're focusing on a couple of things. First is educating their community about what their rights are. And second is holding state and local governments in Colorado to account for the laws that we already have on our books. So there've been several over the past few years, including one that I think is from 2019 that says Colorado law enforcement agencies, local and state, will cooperate with federal immigration authorities if they have a signed warrant by a judge to arrest a person, but not if Immigration and Customs Enforcement just calls them up and asks for help. So this would seem to mean that if ICE wants to do any sort of workplace raids or anything like that here, Colorado law enforcement should not be participating in that. Also with immigration, there's just, it's a rough time because there's interesting stuff coming up, interesting and important stuff coming up. There are 2 programs that provide health insurance for people who couldn't get it before because of their documentation status. Omni Salud provides private insurance, subsidized private insurance. That's been up and running for a few years. And in less than a month, Healthcare Policy and Financing is getting ready to launch Cover All Coloradans, which provides Medicaid coverage for children and pregnant and postpartum people. Given what's going on in Washington, to really make these programs work, data privacy is going to be really, really important. It's going to be just crucial. And we know the state agencies are working diligently on this. They understand the issue and they understand how people they want to participate in these programs are going to have to just have ironclad trust that their personal data won't be compromised. Final issue here in our vulnerability section, and apart from the presidential election really, is our safety net needs attention. Utilization costs are up quite a bit in Medicaid. There was the Medicaid unwind that Sarah talked about this morning, and safety net providers are really feeling this because they have more uninsured patients coming into their clinics. And providers always complain about low Medicaid reimbursement, but they prefer that vastly to no reimbursement whatsoever, which is what you usually get with an uninsured patient. Add those provider rate cuts that we talked about in the budget section, and there's just a lot of financial strain on safety net providers right now. Look for a lot of discussion in legislation about how to figure this all out. Apart from that, the state is now under federal court supervision to create a system of care of behavioral health care for youth who are eligible for Medicaid. That settlement was signed last February, I think. And so over the next 5 years, the system has to be created. And then finally, there's just a lot else going on in the Medicaid space. Next July, the Accountable Care Collaborative's third phase starts. This is a series of contracts with third parties that coordinate care for most Medicaid members. It's basically how Medicaid members get hooked up with their health care. Very important thing. There's other payment reform efforts going on as well. So if you're working in Medicaid policy, you're probably pulling some late nights these days. And that's something to talk about at lunch here too. I'm sure I'm glossing over a lot. So if you find somebody working in Medicaid or the safety net, thank them, be gentle. It's a rough time. And lastly, carrying on with our priorities. First big thing to talk about, what might wind up being the bill of the year, it has to do with drug prices. Specifically, this program called 340B, a federal program. It pits pharma companies against hospitals. Most Colorado hospitals participate in 340B. It gives them discounts on drug prices that they then use to provide more access to care. Pharma companies say hospitals have been abusing this program and pocketing the money, and they're trying to cut back on it. Hospitals are trying to run protective legislation to say, put in state law that the way we're running the program now is allowed. I think around 10 other states have done this. Probably 20 more. We'll see legislation on it this year. Colorado is going to be one of them. And we had a lobbyist tell us that half the lobbying corps has been hired by pharma and the other half has been hired by the hospitals. So that means if you're not part of it, just stand back, right? But if you are, there's going to be I would expect this bill to go long into the session. The issues in the bill will be, are hospitals providing the charity care that they should under here? This is an argument you can expect pharma to raise. And second, exactly what pharmacies qualify. So if you have a rural hospital and they send their prescriptions out to like City Market or something, does that qualify as a hospital pharmacy? This will all be debated robustly in the House and Senate. Our next topic is housing. Perpetual topic here in Colorado these days. We're hearing about a bill that would clamp down on junk rental fees, the junk fees in all kinds of different areas have been a topic of over the last few years. This targets landlords who are charged fees for like picking up people's trash from outside their door and carting it to the dumpster, for example. Also, we hear legislators want to clamp down on landlords' use of artificial intelligence to set rent rates. But apart from that, there's a bill coming up about water quality at mobile home parks. Mobile homes remain our primary source of affordable housing here in Colorado. And lastly, construction defects. This is all about condos. Condos they're kind of the entryway into homeownership for a lot of people. And we have not been building a lot in that market because the builders tend to get sued. And there have been attempts over, I don't know, going back close to 20 years now to reform this construction defects law. The last two failed last year. It's coming back again this year. And the proponents are really looking at it as an affordable housing issue. And finally, healthcare provider issues. We've talked a little bit about that, but there's even more. Providers are really raising a red flag over Medicaid audits. These are cost recovery audits. They say Colorado has a very strict system. They have to keep records going back 7 years. They find the audits really burdensome to comply with, and they say that it's preventing them from really wanting to be Medicaid providers. So it's becoming an access to care issue. Look for maybe a few bills with different ideas on how to go at this. The hospital provider fee, we haven't even talked about this fascinating little thing, but it's basically a fee that hospitals pay into an account. It draws down a federal match, and then hospitals get that fee refunded and then some. Well, Colorado Hospital Association says they've figured a way to get at least another $150 million from that fee just by the way that we have it set up. So great idea, but $150 million in this budget year is, if the state goes ahead and does this, that's going to attract a lot of attention. There are probably going to be a bunch of people with great ideas on how that $150 million could be spent. Facility fees, those are in the news on and off all the time. What you get charged for, basically for being admitted into a hospital or going to an emergency room. Consumer advocates are probably going to have a run at this year. Out-of-network billing, issue that we have, I thought, solved many times, both at the state and then federal level. But there's always loopholes that come up, and providers are saying that insurance companies are pushing them out of their networks and trying to play hardball with the prices that they pay providers. So look for another bill about that. That's our legislative preview. What it really comes down to is, as we said in the 90s, it's all about the Benjamins. I don't think people still say that anymore. Or people younger than me. But before he was famous for being a synonym for money, Ben Franklin was the elder statesman at that constitutional convention that we showed the picture of. And when that convention wrapped up and someone asked him, do we have a monarchy or a republic? He said, a republic, if you can keep it. So we hope what my colleagues and I have shown you here today is a way where we can lean into that republic, be productive members of it, where Colorado can be a leader in that republic and keep it. So thank you so much for your kind attention this morning. And we've got time, I believe, Sarah, for a question or two? Okay. Yes. Here, let me run to you here.
I was wondering if you could unpack a little bit the budget scenario that you said we're in, where the revenues are going up, but also the expenses are going up. Could you just speak a little bit more to what's driving the increased expenses? And if there's a scenario in the next few years where those expenses might be coming down?
Yeah, there are probably a lot of things driving it. One of the big ones, though, is costs in Medicaid came in higher than they were projected to. Another thing is that all that federal stimulus money from the pandemic, legislators tried really hard to spend that on one-time use items, but I think there were some ongoing costs that got built into that. There have been just a lot of new offices and agencies created or old ones expanded in the past few years. And I think what you're going to see in these budget hearings and the JBC's work is those 6 members taking a real hard look at all of those programs, and you'll get more details about it from those hearings, I'd say. Maybe one more? Got a microphone coming to you from the back. Yep. Here we go. Let's try this one.
So one of the things that Trump mentioned was closing the Department of Higher Ed and pushing that to the states. How would that impact Colorado, our budget? What might that look like?
Yeah, you're right. President-elect has said he'd like to close the Department of Education. Education is really a state and local thing, but what the federal Department of Education does is provide a lot of funding for kids with extra needs. So this is where IDEA funding comes from, and where early intervention and a lot of that is federal funded. When he says he wants to close the department, does that mean he wants to cease all those funds? If that's the case, then then it's going to be really rough for not only for school districts, but for the kids who have the hardest time in school. I don't want to downplay that, but I just don't think that's what Americans voted for. Taking education away from kids with developmental delays, that was not an issue in the presidential race. And when the details of this comes out, I don't know. I don't want to be a prognosticator, but I just have a hard time imagining that happening. Sarah? On that note, take it away, boss.
Thanks, Joe. Thank you. And let's give Joe a round of applause. Thank you. Do you have the clicker? Oh, here it is. Okay. I stand between you and lunch, so I am going to be extraordinarily brief, I hope. Okay. Once again, want to give a thank you to our sponsors, Compass One Healthcare, Colorado Health Foundation, our partners at Rocky, Colorado Access, CCHA, Colorado Community Health Alliance, and Connect for Health Colorado. Thank you to our sponsors. Also, let's see. Oh, no, I want to go back. Sorry. Thank you to our colleagues at the School of Public Health, Dr. Bradley. Thank you for hosting us today. And Jeff, our IT genius over here in the corner. Thank you very much. Thank you for letting me thank people for just a minute. Our communications team, there's no one like it anywhere else, and I will stand by that every single day. And Biani and Deanna and Brian and Christy and Joe, please give all of them a round of applause for their amazing work that they have done on making all of this, making this experience be so accessible for everyone who is a part of it. So thank you, Team CHI, Trenton and Mia out front, Joe, Karam, and Emily, our 3 journalists who joined us. So many of you asking great questions. So thanks for all of that. Okay, and before you all leave, don't forget, because we do want to leave on a positive note, focus on what works. So collect those data and invest in your evidence-based programming. Let's find some solutions that we can all be implementing together, and then just get on with it. As Joe said, we got to carry on with our priorities no matter what. If you liked being here in person, we do have a monthly webinar series for hot issues in health. It's only an hour and you can have coffee from home while you're watching it. But please, here's a QR code to sign up to register if you'd like. And I mentioned data, please, we made some changes this year. As you can tell, like we're done with the conference, which feels very strange because usually we go all day and then have a reception later and keep talking till the evening. So we'd love your feedback. Do you like the different location? Do you like the agenda? Do you like the format? Please